Bivalent vaccines are available to those aged 60 and above, as well as healthcare workers and residents at high-risk facilities here on the local front starting this week amid concerns of a twin-demic of COVID-19 and the seasonal flu this winter. So what are the risks of a twin-demic this year? What are the chances of a new variant emerging this winter? And what is the importance of bivalent vaccines amid this reality? Welcome to Issues and Insiders. COVID-19 remains a concern ahead of this winter. And for more on the possible countermeasures, I have Dr. Kim Seung-taek from Institut Pasteur Korea. Dr. Kim, it's good to have you here.
Good afternoon.
I also have Professor Peter Chin-hong at the University of California, San Francisco, live on the line. Professor Chin-hong, again, it's a pleasure.
Same here, Sunny. Thanks for having me on.
Right. Dr. Kim, we'll start here then. South Korea's daily tallies do appear to be stabilizing, but the rate of reinfection that is, has been estimated to be hovering close to 11% as of the end of September, I believe. What does this figure imply, Dr. Kim?
Well, it implies that actually people are getting just vulnerable to just infection. I mean, but this is mostly due to some declining antibody levels. And then we can think about some couple of different the cases in terms of reinfection. The first one is for unvaccinated people, maybe the first infection, then second infection. This kind of is just a third, or the third or fourth infection. This kind of just reinfection cases. For the vaccinated people, we can think about maybe infection, then vaccination, then second infection, things like that. And in some cases, infection, then vaccination, and followed by the second infection. So what this means is that, and then all the data we have actually collected so far is that the sterilizing immunity is something that we cannot attain with this COVID-19, the vaccine that we have now. But then the vaccine, we got some immunity, whether by just a natural infection or just a vaccination. But the good thing is that there are two actually different aspects of immune responses that we can obtain after infection or just vaccination. One is antibody production, and the second one is sort of just a T-cell response. The antibody levels is declining, especially like 3 or 4 months after the infection or just a vaccination. That's something that we know for sure. But the good thing is the T-cell response. This is actually just preventing the severe diseases and then hospitalization and death. That is known to be very long-lasting and just very robust. So for normal, just the healthy, just adults, I think we do not worry too much about the reinfection cases.
Right, I see. Well, that's good to know. Meanwhile, Professor Chin-hong, over in the US, Dr. Anthony Fauci says another variant of COVID-19 may emerge this winter. What are your prospects on this outlook, and how prepared are we for yet another resurgence?
Well, Sunny, the writing is already on the wall. We already have some variants or subvariants afoot. The share of BA.5 is going down right now from about 90%, now about 80% in the US. And we have about 5 subvariants or grandchildren of Omicron that we're looking at. They include things like BA.2.75.2, BF7. So in other words, relatives of BA.2, BA.4, and BA.5. We're looking at Europe, and particularly BF7 is going up in many countries, possibly fueling that surge in Belgium, in the UK, France, and Germany. And in the east coast of the United States now, wastewater levels are rising with the virus. I think that we're hoping that the new bivalent booster will help us prepare, but we're not really sure. It depends on how many people take it, because response has been tepid so far. But on the other hand, more than 95% of people have some sort of antibodies detected in the US. Some of them will taper off much faster than others. So we are going to see what will happen. At the end of the day, a lot of federal funding has dried up. So local funding has to take over local governments to pay for testing, masks, etc., while the federal response is still paying for Paxlovid and vaccines.
Right, I see. And before we delve further into efforts to better protect the public, Dr. Kim, speaking about Dr. Anthony Fauci, and of course US President Joe Biden. Some reports suggest that the rebound in COVID-19 symptoms after Pfizer's treatment may be due to a stronger immune response. What does this mean?
Well, this COVID-19 rebound is not really just unique to the Paxlovid treatment. When the Pfizer actually tried the phase 3 clinical trials on the Paxlovid, they actually, obviously they tested some Paxlovid treatment group and sort of the control placebo group. But interestingly, they also observed the COVID-19 rebound even from some control groups. So this is not quite just unique to the Paxlovid, just the treatment groups. So what we know so far is that the rebound, some people just suspected there might be some resistance mutation after the Paxlovid treatment. That's the number one, just the suspects, the doubt. And then the second is that some people say maybe Paxlovid may somehow just affect our just immune responses, maybe just a weaker immune response, so that maybe just that we observe some rebound after that. But the thing is that after all the outcome so far we have collected, it indicates that there was no just resistance mutation actually associated with the COVID-19 rebound. And also this study also although this is study based on the very just a small number of people, but that they suggest that there's no association with some weaker immune responses with the Paxlovid treatment. So the one thing for sure is that the Paxlovid is still just effective, and then even with the this rebound phenomenon, there's no reason that we actually just expand the treatment period. So far the treatment period is 5 days, but there's no reason to extend such a treatment period as of now.
Right, so we can just keep it at 5 days then.
Sure.
Professor Chin Hong, the Florida Department of Health says mRNA COVID-19 vaccines raise the risk of cardiac-related deaths, especially among males aged between 18 to 39. What has been the response to this particular claim among the pundits within the medical arena, of course?
Well, I think many people, myself included, have thought of this as politics masquerading as science. We don't know who the study authors are. It's just been asserted on the Florida Department of Health website. There is no methodology included. There was no looking into the medical records, which is really nonsensical. It's only looking at death certificates without diving deeper into what the cause of death is. We know that COVID itself does cause much more heart disease than does the vaccine. And I think it's really hard to base an assertion on 20 patients.
Right, of course. Meanwhile, Dr. Kim, bivalent vaccines are being administered here in the country, and authorities are recommending a 120-day interval between the bivalent vaccine inoculations and primary vaccinations or prior infections. Can you explain this time frame for us?
Well, this time frame is basically considering our antibody levels. As I said earlier, our neutralizing antibody levels is declining very fast after 3 or 4 months after the infection or just the vaccination. So then somehow just to boost up the antibody levels, then the government and the authority actually suggesting maybe just a 120-day of just interval. So this is quite just reasonable. And then, as I said earlier, for just a normal healthy just others, I think just this bivalent vaccine may not give much, just a substantial benefit. I mean, the data has not just supported any substantial benefit for this group of people, but for the vulnerable group of people, such as like elderly people, and then the people with some underlying medical condition, and also immunocompromised people, they are very actually weak, and even just to the some very mild infection, they are vulnerable and very easily get to the some very severe condition. So in this case, even just to protect them from the some mild infection, then we might just give them this sort of just bivalent vaccines to give some additional a barrier of protection.
Right, and staying with bivalent vaccines, Professor Chin Hong, as you mentioned earlier, many Americans are shunning the bivalent vaccine. What are the implications of this reality going forward, especially amid talk about new variants this winter?
Well, Sunny, on one hand, we have these tools. We have the bivalent booster. Now, as of today, available for everybody in the United States above the age of 5. It was FDA approved for 5 to 11-year-olds today. But on the other hand, not a lot of people are getting it. Only about 4% of eligible Americans have gotten the bivalent booster. But right now, there's a lull in COVID, and we're hoping that as cases rise, because they will rise as we get colder, that more people will go out and get it. Part of the problem is that many people have gotten recently infected in California in the last 5 months, lots of infections, and the CDC has advised people to wait, like in Korea, for a period of 2 to 3 months after the last infection and last booster to get the new booster. So I'm holding out hope. But the implications are, of course, hospitalizations and deaths, but probably not to the level of the last 2 years because of increased population immunity. What we're hoping for is a dent into breakthrough infections or even mild infections, because they can be so disruptive to society, closing down schools and workplaces, even restaurants and Broadway shows. So it's not going to do any good if it sits on the shelves and not get into the arms of people in the US.
Right, of course not. Dr. Kim, also this winter, local health authorities here in the country appear genuinely concerned about a twin-demic of COVID-19 and the seasonal flu, especially given the recent surge in the number of flu cases here in the country. Do you share this concern? If so, how should we better protect the public here?
Well, we always have to be concerned about this potential, just the cases. But the good thing is for just this COVID-19 and the flu, we have now just the tools to prevent and also just treat. So first tool that we can actually use is that especially just wearing mask, especially some crowded places and the closed spaces. That's very good. And also just washing hands. And this really can prevent many actually infectious diseases, including just COVID-19 and then also flu. And I think I highly recommend this kind of procedure, especially for the group of vulnerable people. And for the second one is obviously just the vaccination. And we have very effective vaccine, especially against the COVID-19 and the flu. And the local government actually now just recommended maybe you can get shot at the same time, and then the one shot in each arm. And then that's something we can try. Also, we can maybe just try some part, like a couple of weeks just apart for these two vaccination. And then the third one is we need a very fast diagnosis and fast prescription and the treatment, because most of the drugs and the successful drugs that we are using right now is based on the inhibition of virus replication, which means that we have to diagnose fast, and then we have to prescribe and then treat very fast. There's a certain window that these drugs can actually can be very effective. Over the certain period, we are actually losing a substantial effect of this antiviral the drugs. So and even in this case, many people most of the deaths are actually observed are being observed among the unvaccinated people. But other cases are also people who can be saved, but then because of the very delayed diagnosis and then prescription and then treatment, we could have saved many people who fall into this group. So the third one, I want to emphasize the very fast and swift diagnosis and prescription and then treatment. That's the key. Yeah.
Right, of course. Mm-hmm. And Professor Chin-Hong, prospects of a twin-demic have also been raised there in the US. That being said, what efforts are being made there to better prepare for this reality?
Well, I think, Sunny, we've been trying to emphasize not only COVID vaccines and boosters, but flu vaccines as well, particularly emphasizing the very old and the very young, although, of course, everyone's eligible for it. I think we're worried about some of the data we brought up and the assertions in states like Florida, which might increase vaccine hesitancy. In fact, only about 50% of Americans say they're going to get the flu shot. And we've been trying to emphasize the fact that the younger population is really going to be at risk for bad outcomes in flu. No population immunity for 2 years, people moving around, not a lot of mask wearing, and the writing is on the wall again, looking at what happened in Australia, New Zealand, South Africa, and other winters that happened before, with an earlier flu season, much higher cases than even before 2019, And we're already seeing it in the US, in New York, Texas, and other areas.
Right, of course, countries here in the Northern Hemisphere. All right, Professor Chin Hong, as always, thank you very much for your time and your thoughts. And Dr. Kim here in the studio, thank you very much for your insights.